society needs to build systems and have systems in place that can allow older people to age with dignity. And in each context, in each country, that means different things for different people. We have a large empirical study, research study, operating in these 4 countries, Malawi, Botswana, Namibia and South Africa. We have a very active public engagement program where we are working with a range of stakeholders, including NPOs, government officials, policy advocates, community members, in trying to create spaces to hear more about and talk more about and co-construct our understanding of care of older persons in different communities across these 4 countries. So we need to think about how we care for older persons. Across the world, different societies are aging. Some are aging rapidly, some are already have high proportions of the population who are older. And in different societies, the needs are different. The care needs of the older population are different. So the question of how we support older persons, how do we manage our societies and support our societies in contexts where a higher proportion of the population are needing care? And so across the world, this plays out in different ways. In some parts of the world, they already have quite high percentages of older persons, and they've had to develop systems, healthcare systems, social care systems that can manage those care needs. Because we all know in our own families that when someone needs care, they need help. You know, women are the predominant carers. That's the same for children, it's the same for people who are maybe living with a disability, and it's the same for older persons. And most of the time that's a family member, it's not just women. So women are caregiving in both paid capacities but also unpaid capacities, and they're quite different. And that's not always fair because we know that load is unevenly distributed to families who have less means, you know, and may not be able to pay for care. Most families across the region can't pay for care. So we got to think about what can we do to distribute that work a bit more evenly and also recognise that work when it's done, particularly by family members. We also need to respect older persons. Older persons have given a lifetime to society. We want people to live with dignity as they age. We want people to be able to do what they want to do, whatever that is. Some people it'll be to be active, other people it'll to be recognised and heard and to be represented.